Hello, my name is Robin Germany, and I'm the Chief Medical Officer at Respicardia and a board-certified cardiologist. I'm often asked how you can prepare for your remedē system implant. You will likely be asked not to eat or drink from midnight the night before the implantation. That morning, you will come to the cardiac catheterization suite where pacemakers and defibrillators are placed. The procedure itself will last about 2.5 hours and is done under moderate sedation. Following the procedure, you'll recover, and then you may stay overnight depending on the physician and your conditions. Before you leave the hospital, you'll be given an implant card. It will give information about the device. Keep that with you at all times, and that way, if any physician has a question about the system, there's a phone number on the back where they can get more information and they can learn more about the therapy itself. Following implantation of the device, you'll be asked to keep the area where the incision is clean and dry for a few days. You may have your arm actually placed in a sling for 24 to 72 hours. But even following that, you'll be asked to keep your right arm below your shoulder for a number of weeks. That's to allow everything inside to heal in. Following that, you should have normal mobility of your right arm and be able to do all of the things you could do prior to implantation. So after the device is implanted, the device itself begins to monitor your sleeping patterns. You'll come back in then at about 4 to 6 weeks after device implant to have the therapy turned on and programmed. The provider will use the information gathered over the previous 4 to 6 weeks to personalize the therapy for you when you come into that first office visit. You'll feel during that visit what the therapy feels like, and the device will actually be switched on so that that night when you go home, therapy will begin when you go to sleep at night, and it will automatically shut off in the morning. In about 6 weeks, you'll come back. The device will then be analyzed by the provider again, and any additional changes that need to be made will be done at that time. And from there, you and your physician will discuss how frequently your office visits need to be. As with any implantable device, there are inherent risks to the procedure, and you should discuss those risks with your physician. In the clinical trial, there was 91% freedom from serious adverse events associated with the device, the procedure, or the therapy, and all of those adverse events resolved with no long-term problems to the patients. In addition, 95% of patients said they would elect to have the implant procedure again. We get a variety of feedback from patients who've been implanted with the remedē system. We hear things such as, "I'm dreaming for the first time in many years," "I'm less grouchy," specifically my spouse says that I'm less grouchy, or overall I'm feeling better and feel like I can think better during the day. Many of our patients are very willing to talk to other patients about the possibility of implant. If you're interested in that, they can match you with a patient who's willing to speak with you. For more information about the remedē system, talk to your provider